Madam President, and all of my colleagues, we all want safety, security, health, and well-being for all of our fellow Americans. But it sometimes seems impossible for us to agree on how best to achieve those goals. So when Congress comes together to find solutions to an urgent crisis facing the country, we should pause briefly, mark that achievement, and consider how we got there. That's what I hope will happen this week when the Senate votes on the conference report on 524, the Comprehensive Addiction and Recovery Act, CARA for short. CARA addresses the opioid crisis in a comprehensive way by authorizing almost $900 million over 5 years for prevention, education, treatment, recovery, and law enforcement efforts. Last week, the House of Representatives passed the report by an overwhelming margin of 407 to 5. We've all heard the statistics about the epidemic of addiction to heroin and prescription opioids that's gripping our country, so I'm not going to belabor those statistics today. When 129 Americans a day die from drug overdoses, we don't need statistics on a page to tell us about this being a catastrophe. We only need to listen to our constituents. I hear from Iowans all the time about the real life examples of how this epidemic is hitting home. A few years ago, I heard the story of Kim Brown, a nurse from Davenport. In 2011, she lost her son, Andy Lamp, to an accidental heroin overdose. He was only 33 years old. She now speaks out on this issue around my state about the need for expanded treatment options for those with substance abuse disorders. She also advocates for an increased access to naloxone, an anti-overdose drug that can save lives. I heard Kim Brown's pleas, and the conference report helps fill these and other critical gaps. I urge the entire Senate to demonstrate that it has heard her and thousands like Kim by passing the conference report and sending it to the President for his signature before we return home. The Senate vote this week will be the culmination of a process marked by hard work, bipartisanship, and a commitment to addressing this crisis in an all-encompassing way. I convened a hearing on attacking the opioid epidemic in the Senate Judiciary Committee January this year. The committee heard from federal and state officials in law enforcement and public health communities. We also heard from a courageous young woman who lost her daughter to a heroin overdose and subsequently started a support group to assist those in recovery. The hearing continued for well over 3 hours. Senators who aren't even members of the committee stopped in to listen and to learn. By that time, a bipartisan group of 4 senators had already introduced the CARA bill. Soon after the hearing, I sat down with Senators Whitehouse, Portman, Klobuchar, and Ayotte, 2 Democrats and 2 Republicans, to build on their outstanding work. The leadership of those 4 senators, bipartisan group of senators on this issue, has been indispensable. We agreed at that meeting on some changes to CARA that facilitated its movement through the Judiciary Committee. I particularly worked to include my accountability provisions, which help prevent waste, fraud, and abuse of grant programs and ensure that resources go to those who need those resources the most. I also helped make sure that a fixed portion of the funds for first responder access to naloxone is set aside for rural areas like my state of Iowa, where access to emergency health care can be limited. And finally, because methamphetamine remains such a problem in my state of Iowa, I made sure that the community-based coalition enhancement grants created by the bill would also be available for communities suffering from high rates of meth use. And that happens to be in addition to opioid abuse. In fact, these enhancement grants are intended to supplement grants made to community coalitions under the Drug-Free Community Act of 1997. I'm proud to have been the lead sponsor of that legislation in the Senate now almost 20 years ago. The CARA Grassley substitute with these changes passed the committee unanimously by voice vote in February. I then managed the bill on the Senate floor, where it was approved 94-1 in March. Tackling important problems in a bipartisan way is important for me. That's why, as chairman of the Judiciary Committee, I've moved 8 bills through the committee, CARA among them, for which the lead sponsor was a member of the Democratic minority. By way of comparison, last Congress, the committee didn't report a single bill for which the lead sponsor was a Republican, then in the minority. And every one of the 27 bills that I've moved through the committee this Congress has had bipartisan support. That isn't just talking the talk on bipartisanship, it's walking the walk. After the Senate acted on CARA, the House of Representatives passed its own package of bills by a vote of 400-5 in May. And so the task fell then to a bicameral, bipartisan conference committee to develop a conference report that would blend the best of the two approaches together. I led the Senate delegation that negotiated the report along with Senator Alexander, who's chairman of the Committee of Health, Education, Labor, and Pensions. We concluded weeks of hard work and negotiations with a conference committee meeting on July 6. I voted for a number of improvements to the report during the meeting offered by both Republicans and Democrats. In particular, I was proud to support Senator Murray's amendment that will create an Office of Patient Advocacy at the Department of Veterans Affairs to help ensure our veterans receive the care they deserve. That's a badly needed thing for the VA to make sure somebody in that department looks out for the patients. I'm also pleased that the CARA conference report includes a bill that I introduced with Democratic Senator Klobuchar of Minnesota, the Kingpin Designation Improvement Act. This bill strengthens the ability of the federal government to freeze assets of foreign drug kingpins who traffic opioids, methamphetamine, and other illegal narcotics into our country. There are other parts of CARA that I feel passionately about as well. Many people who abuse prescription drugs get those drugs from friends and relatives. CARA authorizes an expansion of the federal initiative that allows patients to safely dispose of old and unused medications so that these drugs don't fall into the hands of young people, potentially leading to addiction. I'm proud to have helped start these take-back programs by working with Senators Klobuchar and Cornyn in 2010 to pass a piece of legislation called the Secure and Responsible Drug Disposal Act. It's been a highly successful effort. Since 2010, over 2,700 tons of drugs have been collected from medicine cabinets and disposed of safely. Iowa also has a similar take-back program that's rapidly expanding. Anything that we can do to encourage these programs is really worthwhile. CARE also authorizes funds for other valuable programs, those that encourage the use of medication-assisted treatment, provide community-based support for those in recovery, and address the unique needs of pregnant and postpartum women who are addicted to opioids. It's no wonder that the CARA conference report has been met with such widespread praise and support. The Addiction Policy Forum called it, quote unquote, a monumental step forward. Almost 250 advocacy organizations have written to Congress in support of the report, concluding that, quote, this bill is a critical response we need, end of quote. These organizations include many influential national ones, such as the Community Anti-Drug Coalitions of America, the National Criminal Justice Association, and the National District Attorneys Association. Iowa community organizations are well represented in that group as well, including the Partnership for a Drug-Free Iowa, Kossuth Connections, Siouxland Cares, the Iowa Alliance for Drug-Endangered Children, Community Resources United to Stop Heroin of Eastern Iowa, the Dubuque chapter, the Quad Cities Harms Reduction, which Kim Brown leads, and many more. The National Fraternal Order of Police wrote in support of the conference report as well. The Fraternal Order of Police explained that, quote, law enforcement officers are almost always the first on the scene, even before the paramedics arrive. In these life and death situations, our officers are not looking to make an arrest, but to save a life. Many states and jurisdictions have successfully equipped their officers with naloxone, trained them to recognize the symptoms of an overdose and administer it on the scene. We, meaning the Federal Fraternity of Police, believe that the final conference report on S-524 will help expand the use of naloxone and give us one more tool to reduce the deaths from this epidemic, end of quote. It isn't every day that we can say that legislation we pass could save lives, at least help save lives. But this is one of those times. I want to thank the Republican leader for moving this legislation to the floor and providing the Senate the opportunity to pass this conference report this week. Indeed, heroin deaths spiked dramatically from 2010 through 2014, more than tripling from 3,036 to 10,574. But sadly, during this entire time, the Democratic leader didn't make it a priority to move comprehensive bipartisan legislation on the floor to address the epidemic. Now, some of my colleagues have expressed concern that the conference report, which is an authorization bill, doesn't also appropriate money for this epidemic as well. But thankfully, under Republican leadership, the Appropriations Committee have been doing just that. The current Senate appropriation bills increase funding for this epidemic by 57% over fiscal year 16 enacted levels and by 115% over fiscal year 15 enacted levels. So the funding for this crisis is poised to more than double since Republicans took control of the Senate. As this funding continues to increase, the CARE conference report will be the blueprint for where this money is most effectively spent. This bill is just the latest example of the productive bipartisan work that we've been doing in the Judiciary Committee this Congress. So I want to thank all of the members for their hard work and for their achievement together. So I urge my colleagues to vote to send CARA to the President this week. And when we come back in September, we have to roll up our sleeves and continue to build on this bipartisan success. I yield.